Welcome to your daily dose of healthcare news, where we go beyond the headlines and really dig into what's happening.
That's right. We're going to break down the most impactful news of the day, give you the insights you need.
So let's jump right in. Today's news is buzzing with two major themes.
Yeah, AI is making serious waves in medicine, and we're seeing some big shifts in healthcare systems, policies, and costs.
AI seems to be popping up everywhere. Is this all just hype, or is something truly changing in healthcare?
AI is definitely moving from a theoretical concept to a practical tool. We're seeing it used more and more for things like diagnostics, personalized treatment plans, and even drug discovery.
One AI in particular is making a lot of noise. DeepSeek Health Commentary even ran an article called Hanging Up the Stethoscope, AI Teammates Enter Medicine.
DeepSeek's a large language model developed in China, and it's getting attention because it's super efficient and much more cost-effective compared to some of the other big AI models out there.
The Wall Street Journal even called it a breakthrough sparks national pride in China.
It's interesting because Raman Healthcare is reporting that DeepSeek is already dominating Apple's App Store. They say it's surpassing rivals like ChatGPT and even impacting major players like NVIDIA.
Wow. So what does this mean for the future of AI?
Well, if DeepSeek really delivers on its promise of cheaper development, it could totally change the landscape. It could make AI more accessible to a wider range of researchers and developers, which could be huge.
So are we on the verge of having AI doctors in our pockets?
Not quite yet, but DeepSeek definitely raises some really important questions about the future of healthcare access. Imagine a world where you have accurate diagnostic tools right on your smartphone, regardless of where you live or how much money you make. That's the kind of potential we're talking about.
That sounds amazing, but also a little scary.
Yeah.
What about the risks, like privacy concerns or even potential for misdiagnosis?
Yeah, those are definitely valid concerns. Raman Healthcare actually pointed out that some experts think the hype around DeepSeek might be a little overblown.
So they're saying we should be cautious.
Exactly. Regulation testing and integrating it into existing healthcare systems are all crucial factors that need to be considered before we can really say what the impact will be.
It seems like AI advancements always come with both promises and challenges.
For sure. Okay, so moving on from AI, there's a lot happening with healthcare systems and policies as well.
What are some of the key things we should know?
We're seeing both collaboration and potential roadblocks. Raman Healthcare reported on a new strategic affiliation between the University of Kansas Health System, Newman Regional Health, and LMH Health. They're aiming to expand healthcare services, which is great.
That sounds like a positive step.
Yeah.
But what about the potential policy changes that are being discussed?
Well, KFF Health News reported on Robert F. Kennedy Jr.,
Yeah.
President Trump's pick to lead HHS.
Oh, right.
He's facing some scrutiny over his understanding of basic health policy. It came up during his confirmation hearings.
The Atlantic even mentioned that Trump's healthcare strategy seems to be characterized by unpredictability, which is raising concerns about his whole Make America Healthy Again agenda.
And to add to that, healthpopuli.com is highlighting a decline in trust in public health institutions.
That's definitely concerning.
Yeah, they're pointing to the impact of misinformation, especially when it comes to things like vaccination rates.
It's clear that we need to be critical thinkers and make sure we're getting our information from reliable sources, especially when it comes to our health.
Absolutely. But it's not all doom and gloom. There's some positive news, too.
Like what?
Well, the FDA just approved a new non-opioid pain medication called sustergine.
Oh, wow. That's a big deal.
It could be a major breakthrough in the fight against the opioid epidemic, and Becker's Hospital Review reported on the opening of 16 new ambulatory surgery centers across the country just in January.
So more outpatient care options.
Exactly.
It's clear that healthcare is a complex and constantly changing field with lots of innovation and challenges. But what about the financial side of things? Are there any big developments there that could impact patients' wallets?
Oh yeah, for sure. Financial trends within healthcare are definitely worth paying attention to. For example, Becker's Hospital Review reported that drug makers have raised prices on over 800 medications.
How much are we talking?
The median increase was about 4%, which might not sound like a lot, but it can definitely add up, especially for people with chronic conditions who rely on multiple medications.
So affordability is a major concern.
Definitely. And ASHP is actually urging CMS to reconsider a proposed rule that they say could have a negative impact on patients' access to affordable meds.
It seems like there's a lot of push and pull when it comes to healthcare costs.
Absolutely. The high cost of new medical advancements like cell and gene therapies is also raising questions about accessibility. If people can't afford these treatments, then the potential benefits don't really matter.
That's a good point. And there's the whole digital health revolution that's happening. Ramon Healthcare was talking about intrinsic versus market value in today's health tech M&A market.
Yeah, the pandemic really sped up the adoption of digital health solutions, which has made these companies very attractive to investors.
So we're seeing a lot of mergers and acquisitions.
Exactly.
Mhm.
Companies are trying to position themselves for a future where healthcare relies more and more on technology.
Even Amazon is getting in on the action. They're moving beyond pharmacy services and partnering with companies like Teladoc and even venturing into mental health care.
They're definitely aiming for a comprehensive healthcare ecosystem.
It's a bold strategy, but the complexity and regulations within healthcare could be a major hurdle for them.
For sure. Speaking of challenges, the news of Prospect Medical Holdings selling Cruiser Health to a nonprofit consortium raises some questions about the financial pressures healthcare systems are facing.
Especially those serving vulnerable communities.
Right. The financial sustainability of healthcare providers is so important. We're seeing examples of both resilience and struggle, with some systems thriving, while others are facing tough choices that ultimately impact patients and communities.
But even with all these challenges, there are some inspiring stories of collaboration and a focus on community.
Yeah, for sure. The University of Kansas Health System Partnership is a great example. They're joining forces with Newman Regional Health and LMH Health to expand services. And Romana Healthcare also highlighted the construction of Nevada's first standalone children's hospital.
It's good to see healthcare systems working to improve access and care for specific populations. But it's not just about physical health, right? Behavioral health is getting some much-needed attention, too.
Absolutely. There were several articles emphasizing the importance of mental health for overall well-being. Like KevinMD.com featured a podcast discussing the mental health struggles of medical professionals. And HealthViewX explored how technology can improve behavioral health outcomes.
Centerstone, a behavioral health provider, is making strides in establishing better metrics for measuring outcomes in mental health care. That's got to be a game changer.
Definitely. Having clear metrics is essential for improving the quality and effectiveness of mental health care. It allows providers to track progress, identify areas for improvement, and ultimately deliver better care to patients.
Right. And let's not forget about the healthcare workers themselves. The CDC is really emphasizing the importance of vaccination for healthcare professionals.
Yeah, especially during respiratory virus season.
Yeah.
They're on the front lines, so protecting them is crucial not just for their own health, but for the well-being of their patients too.
Absolutely. Okay, so we've talked about some positive developments, but today's news also highlights some concerning trends, particularly regarding access to care and patient autonomy.
We're seeing this push and pull between progress and resistance, particularly when it comes to certain types of care. Raman Healthcare actually published an article titled "Pulling Out the Rug on Informed Consent, New Legal Threats to Clinicians and Patients."
Wow, that sounds serious. What's the article about?
It dives into the legal challenges surrounding access to care for transgender individuals. Specifically, it talks about how 26 states have now enacted bans on gender-affirming care for minors, and other states are putting up financial and procedural obstacles.
That sounds like a huge barrier to care. What does this mean for those seeking treatment and the clinicians who provide it?
The article argues that these legal challenges could really erode informed consent, which is like a fundamental principle of ethical healthcare. It's a complex issue for sure, with strong opinions on both sides, and the legal landscape is changing so quickly. It's definitely something to keep a close eye on.
Definitely. Okay, so let's shift gears for a minute and talk about some positive news. Remember all the concern around COVID-19? It seems like we may finally be turning a corner.
There's definitely a sense of cautious optimism in some of the reports. Research from Raman Healthcare shows that while COVID-19 had the most severe outcomes among respiratory viruses in the 2022-23 season, those differences were less prominent in the following season.
So that's encouraging news. Does this mean we can finally let our guard down completely?
Not quite. The CDC is still emphasizing the importance of vaccination and preventive measures, especially with flu and RSV cases still circulating. So we need to remain vigilant.
It seems like we've covered a lot of ground today, from AI advancements and political controversies to financial trends and ethical considerations. It's clear that healthcare is a constantly evolving landscape.
It's a dynamic and complex field, and staying informed is more important than ever. As we wrap up this deep dive into the day's top healthcare news, I want to leave you with a final thought.
Okay, what's that?
We've talked about the potential of AI to revolutionize healthcare, particularly with the emergence of surprisingly efficient and affordable models like DeepSeek. And this raises a crucial question. How might this rapid evolution of AI impact access to healthcare globally, both positively and negatively?
That's a thought-provoking question. And it definitely underscores the importance of staying engaged and informed as these technologies continue to advance. Thanks for joining us on this deep dive into healthcare news. Until next time, stay curious.
Well, it looks like we've covered a ton of ground today.
We have from AI's potential to shake things up
Hmm.
to all the political back and forth, financial ups and downs, not to mention those big ethical questions.
Yeah.
Healthcare is one wild ride.
It definitely keeps us on our toes, and that's why it's so important to stay informed. As we wrap up this deep dive into the day's top healthcare news, I'd like to leave you with one final thought to ponder.
I'm all ears. What is it?
Well, we spent a lot of time talking about how AI could completely change healthcare, right?
Yeah.
Especially with these new models like DeepSeek that are so efficient and surprisingly pretty affordable.
Right.
So the question is, what happens next? How will this rapid evolution of AI affect access to healthcare around the world? I mean, will it be a good thing, a bad thing, or maybe a little of both?
That's a really good question. And it just goes to show how important it is to stay engaged and informed as these technologies keep developing.
Absolutely.
Well, thanks for joining us on this deep dive into healthcare news. Until next time, stay curious.